For more now, we're joined in a CNBC exclusive by Marc Miller, President and CEO of Universal Healthcare Services. Look, you're going here, Marc, into 2025 with more acute care customers coming from Medicaid and Medicare. So it seems like if there are broadly this push to cut healthcare costs, that would in fact affect your business. How are you factoring in the proposed cuts from government?
Well, it's good to be with you this morning. We're certainly very aware of what's going on in Washington. We've been spending a lot of time talking with members of Congress about just what you're bringing up. Our perspective is a little bit different. Demand for our services remains very strong. So we're very optimistic, as our fourth quarter showed. For the year last year, we were up over 11% with revenues. We're now close to $16 billion in revenue as a company. We'll be well over $17 billion this year. So the demand continues to rise. While there has been a lot of the discussion about possible Medicaid cuts, what we're being told by members of Congress, we're in 39 states. So we're talking to folks in both the Senate and the House in all of those states. They have no desire to cut Medicaid for those that need it. What they want to do is to get out whatever fraudulent dollars are being spent, or dollars that are being spent in the program that really aren't meant for traditional, true Medicaid recipients.
So Speaker Mike Johnson was actually talking, because it looks like Medicare has largely been put on a back burner. The president has made it clear that's not his focus. Here's Speaker Mike Johnson talking about the proposal to tackle Medicaid.
Medicaid is hugely problematic because it has a lot of fraud, waste, and abuse. The estimate is, I think it's $50 billion a year in fraud alone in Medicaid. Those are precious taxpayer dollars. Everybody is committed to preserving Medicare benefits for those who desperately need it and deserve it and qualify for it.
I know that on your earnings call that you tackled this in some degree, but for investors who want more specifics, if the proposals to cut that much from Medicaid happen, what do you think, how do you think that translates in a dollar figure to your bottom line?
I'm not sure a dollar figure. First of all, from what I'm being told, and again, it's not just the folks in D.C., but the governors have a big part, a big role in this as well. And it's both blue states and red states. Nobody thinks they're going to get to that $880 million number. And they think that, much to what the speaker just pointed out, the fraud, what they're talking about, and there was an editorial in the Wall Street Journal yesterday touching on this, there are a lot of dollars from the Medicaid program that are not being spent on healthcare. And they want to make sure that every dollar in Medicaid that's allocated for Medicaid is properly spent on healthcare patients, recipients. And we want that too. So even if there are some cuts to Medicaid, we don't see that really hitting us, because the folks that are utilizing Medicaid in our hospitals are using it rightly, and they should be getting those dollars. And they need those dollars in order to get adequate care. So, you know, we're taking an optimistic look at about this, given what we're being told by the politicians.
The other thing is there's a lot of pressure right now on insurers denying claims that conflicts with the way that hospitals are trying to make money. And I know that there's regulatory pressure right now on hospitals in terms of those disproportionate share payments that get made to hospitals. So you're facing pressure not only from cuts in government spending, but in broader efforts to get you to prove that the money that you're receiving is being well spent.
Yeah, I mean, a couple different things there. On the disproportionate share, those are dollars that we are being paid rightly that we haven't gotten in years past. And they're needed in order to subsidize the care that we're giving. I mean, Medicaid pays on average about 60 to 65 cents on the dollar for what we're spending. And in the last few years, as wages have gone up, inflation, we had not been getting a raise in the Medicaid, Medicare programs that was close to adequate. So the disproportionate share has started to make up for some of that. And again, I think the politicians understand that, and they're not going to want to cut that. With regards to the health insurers, the government rightly understands hospitals are treating whoever comes to our doors. We treat all patients. We need to be paid for the care that we're giving. And at times, and it's increasing, unfortunately, the last few years, the insurance companies are denying more claims. And so the fight has become a little bit more intense, and they need to pay us appropriately for the care that we're providing to their patients.
The stock price up 2% in the early morning trade. Marc Miller, it's a pleasure to have you this morning. Thank you for your time.
Thank you.